Great, I'm delighted to be joined this afternoon by Dr. Carlos Sevilla and Dr. Carolina Cespedes, the lead clinicians at Star Dental Implant Center here in Costa Rica, to talk a little bit about the work they do with American patients. In order to kick it off, why don't we hear a bit about your background? So, Dr. Sevilla, please can you tell us a little bit about your background?
Hi, Richard. How are you? Well, it's very nice that you're here with us. A little bit about my background. Well, I did my undergrad studies here in Costa Rica. Then I did a fellowship in prosthodontics here in Costa Rica as well before I went to my graduate studies at Baylor College of Dentistry in Dallas, Texas.
Baylor is one of the biggest dental schools in the US, is that
yes,
right?
It's one of the biggest, and right now it's part of Texas A&M. So they actually have a very nice new building. And I did my master's degree as well in there. And then I stayed a couple of years more working as a professor for the undergrad and helping the graduate program as well. And
so not only do you have experience treating American patients, but you also were teaching American dentists how to do prosthodontics.
Yes, I was also teaching the American dentists. And during those 2 years, I was teaching, and I was as well working in the private practice inside the dental school, the maxillofacial clinic. And in there, we were doing big dental procedures with full mouth rehabs, over implants mainly.
Wow, fantastic. So that's a really interesting background. Dr. Cespedes, what about yourself?
Well, we actually know each other a bit now because we went to do our master's degree in the specialty in prosthodontics together at Baylor.
So you're both together at Baylor.
Yeah.
You guys have been a team for a long time.
Yeah.
Quite a bit.
I don't say anything, but I'm actually a year older than he is. So I was actually 1 year ahead. And then after that, I graduated. I also taught for a couple of years at Baylor while I was doing private practice in an implant center in Dallas. After that, I had a great opportunity to acquire 2 practices in Washington State. So my family and I, we moved to Seattle, and I had two implant centers of this big name company called Clear Choice.
Oh yeah, Clear Choice is probably I think they're the largest chain of specialist implant centers in the US. Is that right?
Yes, that's right. So it was actually there where I gained a lot of my experience, helping patients do full restorations of their smiles with implants.
Fantastic. And you've recently returned to Costa Rica.
Yeah.
To join Star Dental, right?
Yep, just a year ago. It was time to spend a little bit more time with my family. I have 2 little kids, and I'm from here. My husband, American, I finally convinced him to come to the great weather of Costa Rica, and so we ended up moving here.
Fantastic,
Yeah.
Fantastic. So if I understand rightly, between you two have placed or restored over 15,000 implants. Is that right?
Yeah, between the both of us, we have done quite a bit of work. That's our main focus of treatment, in restoring implants and helping patients have their lives back.
And Dr. Cespedes, you've done yourself over 2,000 full arch reconstructions.
Yes. That basically, like I said, I owned these 2 big implant practices for 5 years. So basically we were doing 2 or 3 smiles per day. And that's where I was able to help so many patients.
Wow. So, not only are you the most experienced here in Costa Rica, but probably between you guys, more experienced than most doctors anywhere in the world.
Yeah, I would say so. It's quite a few implants.
Fantastic. And so, Star Dental Implant Center is focused on treating American patients. Is that right? Tell us a little bit more about working with American patients, and why do American patients come to Costa Rica for dental surgery?
Well, there are a couple of reasons, right? First of all, having practiced in the US for such a long time, you get to realize that dental treatment in general is very expensive over there, right? And so a lot of people are not able, even though they have the need of large restorations, they cannot afford them, right? And we have the ability of offering that same treatment here in Costa Rica at less than half of the actual price. So from the economical standpoint, I would say that's the main reason why patients come here. The other part of it is, in Costa Rica, we've been blessed of having great education among, the citizens, and we were able to achieve great training. So we are able to provide them with great quality treatment at a lesser price.
Fantastic, and particularly given you guys are both US trained, properly US trained, you can really provide US style treatment, but at a much cheaper price. Is that?
That's right.
Fantastic. Dr. Sevilla, tell me, so who is your typical patient?
Well, in our clinic, it's mainly two type of patients. The first type of patients that we see the most in here is the one that they come with all their teeth and they want their teeth restored with crowns or with veneers. So we do mainly full mouth reconstructions, complex treatments. And our second type of patient is the patient that has already lost all of their teeth or it's in the way of losing their teeth. So we replace all of their teeth with implants and these type of complex restorations.
How, Dr. Cespedes, how does someone know if they're on their way to sort of losing all of their teeth?
That's a good question, Richard. So, they, like Carlos mentioned, they've already either lost all their teeth and they're wearing dentures.
Okay.
Living, I have to say, and this is very important for me, I'm very passionate about this topic in the sense that dentures, they provide a smile to our patient, but they really handicap our patients. The quality of life that patients have with dentures, it's not the one that they deserve. Eating what they want, feeling the confidence to talk with
What are
dentures.
what are the challenges with dentures? And do many people still use dentures?
Absolutely. A lot of people still use them because they don't even know that there's an option for them with implants that can actually provide them with something permanent, something that you don't put in a cup at the end of the day, something that allows you to talk to people with the confidence of knowing that their teeth won't fly out of their mouths, right? And enjoying anything that you want to eat. I mean, I'm a big eater. I love eating. What better than biting an apple straight into an apple? Those things that people are not enjoying. So that's one kind of patient, just like Carlos mentioned. And then the other patients are those patients that, they have maybe one tooth yes, one tooth no, one tooth yes, right? Missing a lot of their teeth. Usually they start with the back teeth. They have partials. They have a lot of challenges, just like dentures. And then also the patients that have periodontal disease.
Well, Dr. Sevilla, maybe you want to talk about it. What is periodontal disease?
Well, periodontal disease, it's mainly, and it's very important to understand this, it's an infection that normally it doesn't only affect the mouth, but it can actually bring consequences with heart disease. And patients with diabetes are more prone to have more complications with the infections. But it's mainly what happens is that the bone that surrounds the tooth starts going away and the teeth start moving. So it's pretty important to take care of this situation.
So is this something that you can, you can have periodontal disease for a long time and treat at some stage in the future with implants, or is it kind of time sensitive?
Well, Richard, periodontal disease it's a chronic disease. In other words, it's not something that happens overnight, but it takes time to develop, right? It starts with sometimes patients, they feel like they have bad breath, or their spouses or their friends, they may comment on that. These patients are patients that are usually ashamed of kissing their wife, kissing their girlfriend or boyfriend, being intimate with them, right? So it starts that way, and then slowly this infection, it starts chewing that bone away, right? And that's when the teeth become mobile and patients teeth fall out of their mouths. The problem with periodontal disease is that if you let the disease go too far, there are two risks. One is that it can cause issues with your health. So you may end up with heart disease, stroke. It is related to Alzheimer's now. Digestive issues. I mean, so many things that this infection actually causes to your overall body, right? And the other risk that you may run into is that this disease takes the bone away. And when we're helping our patients with implants, we need bone to fit those implants in there, right? And give them permanent teeth. So we don't want this disease to go for too long because we may run into that situation. Still, we have ways of helping patients that they have no bone. I have never been able to, or I've never told a patient, I cannot help you, right? But it just will take more time, maybe more investment. So I would say to those patients that have periodontal disease, don't wait.
Okay.
Don't wait, because I don't want you to have health issues, but also because on my side, I want to help you with implants and we need your bone.
Absolutely, very interesting. And if I understand correctly, Star Dental Implant Center specializes in these large treatments. It specializes in treating patients from the US. Is that right?
Yes, correct.
And Costa Rica is quite a long way for people to travel to come for dental treatment. But it's quite a popular procedure here, and I believe a large number of Americans come here every year. So how is Star Dental sort of differentiated from some of the other clinics here in Costa Rica that claim to do something similar?
Well, first of all, and I would say, Richard, that I know that Costa Rica and being another country and being in Central America or South America, how it is recognized by Americans, it seems too far away. But truly, we are. There are direct flights from the US into Costa Rica from all the main cities. We're 2 hours from Miami. I used to travel way more coming from Seattle. So really we are very close, okay? And the big gain for this trip is, you'll get your smile at half the price, right?
So also, Richard, well, I don't know if you know, but we have like about 1.5 million American tourists coming to Costa Rica every year, which makes it it's quite a bit, and it makes it a very popular country to come to. And also at Star Dental, what it's also very good is that we have a very special concierge service for the patients, and we have a team that is going to guide them in all the process of how to come here to Costa Rica, with the tickets, with the hotels, and what's going to work for better for them. So we're literally helping them come here to Costa Rica and make things as easy as possible.
Holding their hands.
Fantastic.
Literally holding their hands.
So coming back to the question, how are you different from some of the other clinics here in the country?
Yeah, that's also a very good question, in the sense that, one of the things that makes Costa Rica a popular destination is that we have several places that offer dental services to Americans, right? But there are a few things that really makes us different. One is that at our clinic, we're all specialists. And what I mean by specialist is specialists recognized by the ADA, right? The American Dental Association.
So what kind of specialists are they? So
endodontists. We are prosthodontists, specialists in smile design and reconstruction of the mouth. We have oral surgeons. So basically, every person that will touch our patients will be a specialist. It's important to mention that there are differences.
Some clinics don't have that.
Correct. There is a very popular specialty called implantology, where some people do not a very formal training or not as lengthy training in doing implant reconstructions. However, everything is done by one person at that point. Placing the implants, doing the smile design, restoring the implant, all of it is done by one person with maybe a year or two of training. When you have these very complex full reconstructions and implants, you have to think about it as the heart surgery of the mouth. It's the most complex restoration that can be done in the mouth. So if you are going to have heart surgery, you want to make sure you have a very specialized and known heart surgeon. You don't want a general surgeon.
So an implantologist is not seen as a specialist on the ADA?
No, they have had some training and they do some restorations. But what I feel so comfortable about talking to my patients and providing this treatment is that, Carlos and I went through a formal training of 3 years in order to know how to design a smile, how to make it functional, how to make that patient chew and talk and smile like if those were the teeth that he was or she was born with, right? The oral surgeon that is next to me, day of their procedure, they did a 4 or 5 year training on just how to put the the screw, the actual screw in the bone. And so in total, you have a training of 8 to 10 years as compared to just 1 or 2. So we have a team that fully specializes on that. And then the other part that also makes us difference is there's a level of expertise that only comes through repetition. And you mentioned some of the numbers of the amount of implants we've restored in our lifetime. And it's not easy to get there, but the knowledge that you achieve through this repetition definitely makes us different.
And other dentists in the country, they say they are also US trained. They generally trained to the same level you guys are?
Some of them do, but most of them don't. So what happens normally is that they go to the US and do a course 6 months, or many times it's just a week or 2 weeks. And then they start using the university where they went for these courses as if they have trained there. Unfortunately, we have that situation. So that's one of the things that's actually happening here. And as Carolina said, it's very important to make this an important issue or an important distinction that we're working on very complex rehabilitations.
So coming back to what differentiates you from some of the other dentists operating here, if I understand correctly, you were both members of the American College of Prosthodontists, and Dr. Cespedes, you are American Board certified. What does that actually mean?
Well, once you finish your training, right, then you present your work to the board. The board is basically a panel of experts in the matter. They're very well known across America, and then you present your work, you defend your work, you explain your work, and when you complete this work with very high standards of care, then you are awarded a fellow of the American Board of Prosthodontists.
So it's a pretty important qualification.
I would say it is, because I understand. I put myself in the shoes of someone that's coming to a different country, right? Of someone that is taking the risk. They want this smile so bad, right? They want to recover their lives again so bad. And they're willing to go through the risk, if you want to put it that way, of traveling to a different country. And what this tells our patients, is that they are being treated by doctors that were trained in their country, that have the American standards, that will provide them with the quality that they deserve, that they would get in the US just one fly away.
Fantastic.
Does that make sense?
Yeah, no, I think that's a really important point. I imagine a number of our viewers are sort of trying to understand what the process is like for them to engage with Star Dental and the steps they need to go through to come down here and restore their smile. Could you talk to us a little bit about what the patient journey feels like?
Well, a little bit specifically about the journey. Our patient coordinator is going to help you book the hotel and help you to find the best tickets. Once everything is ready, we're going to have our driver that is going to pick a patient at the hotel, at the airport, and bring them to the hotel, and bring the patient to the clinic as well. As of how many trips the patient needs to actually be here in Costa Rica, that's going to depend completely on the treatment that it's going to be done.
Okay, so from what I understand, you guys specialize in implants and particularly into full mouth restorations, or as I believe that some people call them all-on-fours. Maybe we could talk specifically about what that process feels like with regards to the amount of time patients spend here and in between different aspects of the treatment.
Yeah, sure. We do quite a bit of all-on-fours or full arch restorations. And for those type of patients, first of all, most of treatment is actually done in 1 day, and that's the very famous, 1 day treatment. Truly, they will have to come to Costa Rica on a first visit for about 7 days, right? We'll have their first appointment where they will have their smile design. I love that appointment because that's where we get to talk about the fun part, how you want that smile to look. Color, shape, size of the teeth, right? That's where it's valuable when patients bring pictures from how they used to look or how they love the smile, or sometimes they bring a picture of an artist.
Or they want the Hollywood smile.
Absolutely. And then, so we talk about that, how they want their smile to look. We take pictures, impressions, gather all this information so that the day of surgery, that usually happens 1 or 2 days after that, we have these bridges pre-made for them with those characteristics that we discussed on that first appointment. And now the day of their procedure, or their transformation, as I like to say, because this is when we change their lives really. They spend with us, about 6 to 8 hours. We do the surgery, placing the implants in that bone, making sure that they're secure in there, and then going through a process of adapting those teeth to the implants. And after that, after those hours in our center, that's when they walk out with something that's already permanently attached, and it's their new smile, right? This new smile is just their first smile. It's their test drive of their smile. So from the functional and aesthetic standpoint, they get to take it back home to the US for 3 months while those implants are healing, while that bone is fused into those implants, and they get to show it to people. And they show it to their friends and family. Many times they come back and they want the teeth to be brighter, right? And they will come back on a second trip. That second trip happens 3 months or 4 months after their first visit. And that's when we create the final version of that first healing set of teeth.
So the final set of teeth comes in the second trip.
Yeah, that's right. So with that, like we mentioned, we were mentioning that on that first trip, they will walk out of the office the same day with something that's permanently attached. However, it is not the reinforced version of that will be the final set of teeth, right? So they go back home for 3 months, and they will come to that second trip where they will stay again for several days here in Costa Rica, and we will fabricate that final version of their teeth, the one that it's reinforced, the one that will allow them to grab an apple and bite into it, or have a nice piece of steak. So we can do, like Dr. Sevilla mentioned, we can do any change from that healing set to that final set, so that when they get that final reinforced version, it will be perfect from the aesthetic and functional standpoint, and will allow them to do whatever they want.
Fantastic. Well, thank you so much for your time today. It's clear that you guys are both really passionate about what you do. So, tell me a little bit more about your motivation to finish up.
Yeah, well, it's very gratifying to actually see patients' life change completely. The person that actually comes in, that the patient that actually finishes the treatment with us, their smile, how happy they are, how their life changes, and seeing that smile, many patients cry with us, and that's one of the things that's why I love what I do. I mean, it's seeing the happiness of the patients. I think that's so gratifying, and this is one of the main reasons of why we do this job.
Yeah, we have patients. I mean, when we talk about patients, we talk about stories, and I get to hear all these people tell me how their lives have been affected by not having the smile that they want, not feeling confident, not feeling healthy. And knowing that, with what we do with our hands, we can reach into their souls and actually pull that person from within, right, through their smiles, and make them feel fulfilled, make them feel like they can go out back into the world and take it for them.
What a gratifying thing you do. Thank you so much for your time today.
Thank you, Richard.
Thank you, Richard.